Hello and welcome to Medical Terminology. We are now in week 2. Very exciting. We are going to add to your knowledge about the general terms used when referring to the different directions and aspects of the body. Of course, this is incredibly important because you have to know what, where, how, what, depending upon your job. Now, if you're going to become a nurse or a medical assistant or other clinician, you have to know where to put the injection or how to set the patient up. If you're going into administration, then you need to know for coding purposes and interpreting the documentation. Okay, so are you ready? This is exciting. All right, maybe that's a little overboard. So we're going to talk about anatomical directions, planes, and positions. Very, very important. So these terms, I thought we would start out with the terms that everybody uses. They're even in the names of some of your courses or maybe on the cover of a textbook that you're working with. But sometimes people forget to even tell you what they mean. So anatomy is the term used for referring to the structure of the body, of the human body. Although there are an anatomical, of course, references to many and all species. Okay, that's what they teach in veterinary school. Okay, so all it is the structure of the body that you're discussing. The anatomical site is very specific. Okay, a very specific part of the body, a location in the body. So it's not enough to just say the heart. You want to talk about the upper right atrium of the heart or the lower left ventricle of the heart. Anatomical site, very, very specific. Pathology is the study of disease. So you know how when you might get blood taken and they're going to the laboratory and the pathologists, they will analyze your blood, and what they're looking for is an element of disease, or hopefully not an element of disease. Okay, now you've heard pathology, and maybe you heard also pathophysiology, which is different, which is why it has a different word. Okay, pathophysiology is the process of disease. So if, for example, I hope not, you might know of someone who is diagnosed with cancer, and they may refer to them as stage 1 cancer, stage 3 cancer. Okay, that is an example. The staging of cancer is an example of the pathophysiological study of that particular cancer, because it explains how far the disease has progressed. Okay, and then you might hear the word etiology. And etiology is the study of the causes of disease. So you see how we parse out the specific meaning of all of these terms to be very specific. And working in healthcare, the reason why, regardless of what your future job title and job responsibilities will be, whether it's clinical or administrative, the fact is that I want you to remember specificity is the most, well, accuracy is most important, but specificity is right there next to it, okay? Because we need to be very specific with regard to any aspects of the patient's health. And this is something you want especially if you are the patient or someone you love deeply is the patient. Okay, so now you understand these terms that are built around not only your courses, but you will be asked, do you know anatomy? Do you know pathophysiology? Do you know anatomy and pathophysiology? All that stuff. Now you know exactly what it's referring to. Okay. Any questions? Okay. All right. So now we're going to look at the way theoretically the body is divided up. Okay. We don't, not like the magicians, we don't saw people in half. But if we were going to saw somebody in half at the waist, that would be sawing them in half in the transverse plane, because transverse means across. Okay, transverse. And when we get to the digestive system, you're going to learn about the transverse colon, which is one portion of your large intestine. How exciting is that? Look at, you're already advanced. Okay. The sagittal plane divides the body in half vertically, right and left. Okay. And remember, whenever a physician or any direction or relativity to the laterality, which is the term referring to right and left, okay, it's always the patient's right, not the physician's right, not your right. Okay. So if you are asked to give the patient an injection in the left arm, it's the patient's left, not your left. Okay. So all reference to laterality is going to refer to the patient's right and left. Okay. And that's the sagittal plane divides between right and left. And then one more, we have the coronal plane, which divides the patient also vertically, but vertically front and back. Now, what do you have to know this for? Because there are lots of parts of the body that are very specific to right or left. Like if you're going to donate your kidney, which is a wonderful thing to do. Okay. And you want to be donating, and you know, if they're going to take, let me back that up. Okay. If you're going to be, if you have a patient who has kidney disease, this is better. Okay. If you have a patient who has kidney disease and they're going to remove the diseased kidney, it is important that they remove the diseased kidney, not the healthy kidney. And this will be referred to in the operative notes, right or left. Okay. And trust me when I tell you, there was a case about, now it's probably about 20 years ago at a hospital in Tampa, Florida, where they had a patient who had very severe diabetes, uncontrolled diabetes, and his legs were in a lot of trouble, and one of his legs had already developed gangrene, and so they were going to amputate the leg. Okay. And it was a long story, but it was entered improperly into the computer, and so the surgeon ended up amputating the wrong leg. It's a fact. You can look it up. Email me, I'll send you the case. Okay, so this is why, and if you're going to be a medical coder, you have to make sure you put the code for the right or the left, whichever is being removed or treated or whatever it might be. And this is very important as well, and mostly important for continuity of care. Okay. Anybody have any sense going on here? Does that make sense? Thank you. Okay. All right. So now we have those were the anatomical planes. Now we're going to talk about anatomical directions. Superior means above, so closer to the head. All right. So your knee is superior to your foot. It's closer to the head, right? Inferior means below. Now, some of you who might be a little older might remember that managers used to be called superiors, but that has a negative connotation to it because no one person is better than another person. So that's why we now use the word supervisor. But in healthcare, it is a direction and has no negative or positive connotation. It is just identifying direction. Superior, closer to the head, inferior, closer to the feet. Okay? The surface of the palm of your hand. It's the palm of your hand. So that can remind you palmar is referring to this. And the surface of the sole of your foot. I could show you because I'm not wearing shoes, but okay, so this plantar. You won't forget that quickly, will you? No, because seeing is understanding, maybe. Okay, it's a good thing I'm wearing pants, right? Okay. All right, moving on. Now we're going to go to laterality. And remember, again, laterality is always the patient's left side, the patient's right side. Lateral just refers to side. Okay. Bilateral means both sides. So if, for example, we have a patient come in for a knee replacement, and the patient's going to have both knees replaced, that would be a bilateral replacement, both sides. And when you think about it, there are a lot of parts of the body that have two sides. Okay, your eyes, maybe the physician is doing a bilateral cornea removal. Okay, that says both eyes were done at one time. Okay, but this is also why it's important to identify the left eye was done, but not the right eye, because that way we can track and see if the cataract comes back. We know that, oh, that was the eye that was fixed. So we have to look at some other underlying cause. Okay. Center outward. So medial means minimum. No, it doesn't. Medial means middle. Proximal, nearer to the center. Okay. Nearer to the center of the body. So your shoulders are proximal to your head. Distal means away from the torso. Transverse, do you remember from like 10 minutes ago? Anybody? Right. Transverse means horizontally, side by side. Transverse. Think about a subway train or a highway going across. Transverse. Like transportation. I'm going to stop now. Okay, moving on. Front to back. Wow, isn't this amazing? You have one human body, and yet all of these different terms to refer to different aspects of that body. And that's why not everybody can work in healthcare, because it's complex. So remember, review, 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 so it sticks in your head. Anterior, the front. Do you remember last week we talked about the prefix ante, A-N-T-E, means before? So now we have anterior, meaning the front of the body, ventral, along the belly, also the front of the body, but used in different manner. Posterior is the back. Dorsal is along the back. So you see that there's one thing that's a direction, anterior, posterior. Most often you will see this referred to in the approach of a procedure. We went in anteriorly from the front. We went in posteriorly from the back. Spinal surgery, very often, one way or the other. Both are done, okay? Dorsal, the way I remember this is, have any of you ever seen the movie Jaws or know about sharks from Shark Week? Okay, the way you know that a shark is in the water nearby is because you see what? The dorsal fin sticking out of the water. That's the fin on the back of the shark. The shark's, got it? So that's along the back. All right, if you have a patient that has a dorsal fin, you might be in the veterinary hospital and not in the human hospital. Just an alert. Okay, now, so we have top to bottom, we have inside, outside, we have outside, right side, left side. Now we have inside, outside. Visceral refers to an internal organ. So if there is a procedure that is going to involve attention to a visceral portion of the body, that means they're going in. I'm hearing feedback, so could somebody turn off your mic, please, unless you want to talk. Did you do it? You did it. Thank you. Okay. I mean, really, listening to me once is really sufficient. You don't need to be listening to me twice at the same time. Okay, that's a little confusing. But all right. So visceral refers to something inside the body. Okay. Deep, I know that's a regular word, right? But not in healthcare. In healthcare, deep means they're going toward the inside, such as an incision. Medullary, and you might hear this often, and I know I've heard it. Sorry, the dogs they already heard this. They already know this. Okay, so medullary refers to an inner region of a particular part of the body, okay? And I know I heard this on a commercial for some medication, okay? So turn off your cell phones. Oh, wait, that was me. All right. Parietal is the outer wall of the body. Superficial on the outside, on the surface. And outer area is going to be the cortical area. Now, superficial and cortical, you might believe is something external to the body, okay? Like a mole might be superficial, meaning it's not going into the deeper layers of the skin, or a lesion. However, superficial doesn't say it means on the outside. It says it means along the surface. So if a physician is doing an investigatory or a diagnostic search and finds a lesion superficial of the kidney, that means that it's along the surface of the kidney, not internal, not deep or medullary of the kidney, which of course is an important thing for us to know. Okay. I know, what am I like reading out of the dictionary? I'm trying to parse these so you can get a better understanding of how these terms are used and why these terms are used. Okay. But what am I going to tell you at the end of this? Well, I guess it's only week 2. I'm going to tell you this 1,000 times during our time together, which is you cannot learn this instantaneously. You got to review, review, review. And when you read the term and its meaning for the 25th time, it will stick in your head and then you won't have to look it up anymore. Right? Okay. An affected area. Localized means a small area. Maybe a rash just on the hand or just on one location of the arm or something. Generalized is affecting a large area of the body or an indescript area, which means it's so spread out in the body, we cannot identify specifically where it is. And then proliferative, if you know somebody who has proliferative metastatic cancer, go visit them very quickly. Okay, proliferative is replicating with frequency throughout the body. And normally this is referring to something that's replicating that we don't want to replicate. We don't want it to be there. So this is also, oh, I get to stop for a PSA for preventive care. Early diagnosis is always the best avenue. So maybe you don't want to go get a colonoscopy. Maybe you don't want to get a mammogram. Well, you know what? It's like moments in your life and then it's done. But if they catch something, then it's only a few more little moments as opposed to years and years of procedures and services and, oh, pain and suffering. You don't want that. Okay. Make sure you stay up on your preventive care. Preventive care and early diagnosis will prevent something inside from replicating with frequency. All right, now we're going to talk about holes, spaces, wide open spaces. Yeah, not really, but in your body, you have cavities, not a cavity like in your tooth, but isn't this interesting? A cavity is a space, okay? So in your tooth, when you get a cavity, that means bacteria has eaten a hole. So basically a cavity is a hole or a space where you're not supposed to have it. But in your body, you are supposed to have 6 spaces because these spaces contain stuff that's relatively important to your existence. So the first cavity we have is the cranial cavity. The cranial cavity houses, your brain and all that your brain does, all of those pieces parts. Okay. Tympanic cavity. It's not on your chart. Anybody want to guess? Okay. Ear. You know, your eardrum is your tympanic membrane. It's a space wide open going right into your head. Okay. You have your nasal cavities, which if any of you have ever had a sinus infection, you're well aware of your nasal cavities because then they are cavities that are specifically filled with excessive amounts of mucus and nobody wants that. Okay. You have your spinal cavity, which guess what? Includes the space that houses the spine and your spinal cord, which goes right down the center. Okay. And your thoracic cavity is your chest, which houses, it's framed by your ribs It houses your heart, your lungs, very important things, okay? Very, very important things. Heart, lungs, gotta have it, okay? So if you have ever heard, and I've heard this on TV and doctor shows, oh, he's a thoracic surgeon. That means he is a specialist in operating on the human chest and all of the things that go on in this portion of your body. Okay, some more holes in your body, spaces, your oral cavity, which is where you don't want to have dental cavities. That's a big space. Okay, your pleural cavity, plural referring to your lungs. Your lungs are inside the pleural cavity that is within the larger thoracic cavity. Your abdominal cavity, what you have inside your abdominal cavity differs whether you're a male or a female. Or I should say whether or not this has nothing to do with sexual identity. This has to do with anatomical parts, okay? And your pelvic cavity, which is down there between your hips, okay? All right. So you all have all of these terms and their definitions memorized, right? Thank you. No. Not unless you're Sheldon from The Big Bang Theory or whether you're Spencer Reed from Criminal Minds. I like both of them. Okay, review often, review often, review often. Take their notes with you on the bus or the subway. Or if you're driving but not driving, if you're a passenger in a car, that's good. If you are driving, you might use the audio review that's included in Connect and connected on your smartphone. Okay, review, review, review. Very important. That's the only way you're going to really understand. Use your medical dictionary without a second thought. If you come upon a word, a medical term that you do not instantly know, look it up. Look it up every time until this is a phalanges. Okay. And then if you're overwhelmed, if you're frustrated, before you get frustrated, query. In this case, you're going to query me. You're going to email me and say, I don't understand this. Okay, but please email me before you get to that point. Email me when you're like, not, okay. And we'll talk it through. We can email back and forth. We can set up an appointment to speak on the phone. We can do a one-on-one Zoom session. We can FaceTime, whatever is best for you. I want to see that light bulb lit over your head. Okay. And remember that understanding these terms not only helps you with your success in your future career, it helps you because no matter what you do, at some point you are a patient. At some point you are accompanying somebody you love as a patient, a child, a parent. Oh, I used to have such a good time taking my parents to the doctor. And I say that because I was so, oh, you're going to do a procedure. Can I watch? Can I understand? Can I ask a million questions? Sometimes that wasn't very daughterly of me, but I was there. Okay. The point is, I'm here for you. So please just read it through, read it through, read it through. You'll get to know it. Okay. Anybody have any questions? Okay, then, if you do have a question, what are you going to do? You're going to email me. Of course you are. Have a wonderful, wonderful day. I'll post the recording for this in a little bit. And have a great Labor Day weekend. See ya.